Hello everyone, Trina Baker here. I have chosen to discuss the ah sound and how we make the ah vowel sound. The text has a great table that was also referenced in the lectures. I believe it's on page 188. So for the ah vowel sound, the table gives the example of cot. Ah is probably the most open of the vowel sounds, with pretty much no lip rounding. When you're going ah, your lips are very open. They're not constricting. And if you pay attention, you can feel your tongue on the bottom of your mouth, just kind of laying there and almost kind of scooching back toward the back of your mouth, towards your throat. It also makes a difference how your jaw or your mandible is to say ah, because if you don't open your mouth that wide, ah, it makes a completely different sound. Similar, but not the same. One example of this is when my daughter practices articulation when she goes to speech. One of the things she has to do is practice different facial movements. One of them is like ee, and another one is ah, a really big ah, to make sure she opens her mouth. And they're kind of exaggerated, just so she gets the correct feel. So when she goes to make a word, it will sound right. Like kite, she has some trouble saying that correctly. So the SLP will sometimes have her exaggerate the I, and then say kite. So words like kite and bite that have those diphthongs in them that are kind of combinations of the vowels. But it just struck me when we were doing this chapter, the comparison, because that's a really big contrast for the ah, how open it is, and then the e is real closed. That we put those together without thinking about that, but somebody that has trouble has to do that on purpose. So my daughter has to practice opening her mouth really big for the ah, and then kind of doing this constricted movement, but the lips are still kind of open, but the teeth and the tongue are for the e. So it's a big switch. And that's what I got.